Hello everyone and welcome to this edition of the Poverty Reduction Tools for Frontline Staff call. Today we're doing a session focused on winter wellness. This is part of a two-part session for professionals preparing for the winter. Today is focusing from a health perspective, and then the session in 2 weeks we're going to look at what support is available in the community for residents. First up, we have Tashin Khan to talk to us about winter wellness from a health perspective and kind of including vaccinations and flu. So I'm going to pass over without further ado to Tashin to present, if that's all right.
Thanks, Charles.
Introduce yourself and go for it.
Sure. I can't. It seems to not let. I don't know whether it's because it's a MacBook, but it won't let me
I'll
share.
get your slides up.
So, yeah, if you can share for me, that would be great. So yeah, my name's Tassin Khan. I'm a GP in Hackney in Springfield Park and Spring Hill practice specifically. I'm also the clinical director there of the primary care network, and I lead the North Hackney immunisation project, and I do some strategy work for NHS England around vaccinations. So yeah, my kind of specialist interest area, and I guess what you'll be hearing kind of about is vaccines, but kind of more generally, this is a presentation about kind of just staying healthy in the winter and the challenges that our residents may face and staff may face as a result of the sort of winter weather. Perfect, I can see my slides now. So yeah, so that's kind of the aim of the session. But although there's a few slides that I want to talk through specifics around keeping healthy and the different types of vaccines that you might be offered, I do want it to be interactive. So I want to leave as much time at the end as possible to ask questions, and I can try my best to answer them. So yeah, I'll go on to the next slide if that's all right, Charles. Perfect. Oh yeah, so this is what I've already talked about, that it's vaccines and keeping healthy. So on to the next one. So yeah, so why winter wellness matters. So we know that older adults and vulnerable residents are faced with increased risks during the winter. Cold weather can impact on immunity, and particularly if you've got underlying health conditions, it can really sort of trigger some of them. So for some people, if they have asthma or COPD, which is a chronic lung disease, particularly found in people that smoke, they're more exposed to viruses, and they're more likely to have serious infections during the winter as people spend more time indoors, and there's more of a risk of these viruses to spread. So there is an increased risk in particularly our residents that have got underlying health conditions. And we also know that actually those people that have underlying health conditions are more likely to come from deprived backgrounds or minority communities. So there is a disproportionate kind of way in which winter illnesses affect people from those communities, so both deprived and also minority communities. And we saw that in COVID, for example, where actually it was our older, most vulnerable residents and also minority communities that bore the brunt of some of the early deaths and morbidity around COVID. And that applies to flu and other disease outbreaks as well. So if you go on to the next slide for me, I'll start by talking about flu, which is a virus that circulates in the community and usually starts picking up around this time of year. And people often, think that having the flu is like a simple cold, and for young children, actually, it usually is quite minor. But actually, if you have a weakened immune system, if you have immunosuppression, or you're in some of the risk groups that are outlined in this table, so particularly older residents and people who are pregnant, and as I said, if you're in one of the clinical risk groups, then you are more at risk of flu being actually quite a serious illness for you, and it can lead to hospital admissions, it can lead to intensive care admissions, and we see a sizable number of people being admitted and unfortunately dying of flu every season, and there is an anticipation of this flu season being particularly bad, because we look at our forecast based on what happened in the Southern Hemisphere, so in Australia, the previous year, earlier on in the year, and it looks to be a busy season this year. So people, as I mentioned, chiefly those people over the age of 65 and those people with underlying health conditions. But it's also important to remember that carers who get carers allowance, or those who are the main carer of an elderly or disabled person, are also eligible for flu, because this is to recognise that they live with and care for a vulnerable person. So if they come down with flu, then they can't care for their, for their relative or contact, and also they have a risk of spreading it to them as well. So it is important to remember that. And actually, I still come across, patients that I consult with on a day-to-day basis that they don't know that they're eligible. So there is that, the eligibility, and that's kind of the gift of vaccines, is that you're not only protecting yourself, but you're protecting loved ones around you and your community as well. So the next slide. Yeah, so COVID-19 vaccination. So we know these have been around for a number of years now, and the cohort mainly overlaps with flu vaccine eligibility, but actually the age cohort is a bit older. So whereas those over the age of 65 are eligible for flu, it's actually those over the age of 75 for this season, and those people in care homes and those people who have got underlying immunosuppression. So that can be because if you're on long-term steroids, for example, if you're having chemotherapy, which means that you're not able to tackle COVID infection. We know, again, like flu, that it's more likely to give you a serious illness. And so it's important to get both your COVID and flu vaccine. And actually, you can get them both on the same day. We've started the flu campaign and the COVID campaign roughly about a month ago now. So you should, if you're eligible for a vaccine, you should have been contacted. And there's a few ways of getting that. So there's, for example, at Spring Hill practice, we are vaccinating everyone that lives in Springfield Park, so the 3 practices in the north of the borough. And then there's another offer in Richmond Road practice in the south, who are offering vaccines on a wider footprint across City and Hackney. And there's also the community pharmacy offer as well. If you're not sure where to get them from, you can go online and just search for COVID vaccine NHS, and it will show you where your nearest site is. And some of them you can walk in without an appointment. So yeah, it's really accessible to get a vaccination. And the reason why because one of the questions I get is, why do I need to keep getting COVID vaccines twice a year? Or why do I need an annual flu jab? And it's because viruses are extremely clever. They change the way that they look to the body. So we might not remain immune to them once we've encountered them. So they change on a yearly basis. And so the latest vaccinations have the circulating strain that is most responsive to what's spreading in the community. So it is important to keep refreshing your immunity, because it may be that this year's strains are completely different to last year's, and they've evolved into something that actually previous jabs won't protect you against. So for those people that are eligible, it is important that you do come forward and have a timely vaccination so that you're ready for the winter. And then, of course, we know that for COVID, for the foreseeable future, there's also a spring jab as well for those that are particularly vulnerable. Next slide, please. So this next one is pneumococcal vaccination. So this is a very specific vaccine that protects against severe pneumonia and meningitis. Again, this is for people aged over 65, and there's a single dose, and some people are eligible for a booster as well. And it complements the flu vaccine, because both can lead to respiratory, so lung disease, which can be very serious. And it's also part of the routine immunization schedule as well. So babies get it at age 4 months and 1 year as well, because the key demographics that pneumococcal infection particularly affects our babies and those who are older residents. So again, a really important vaccine, and one that you can have with others as well. So I mean, it might be that you want to have it during different visits, but it's a very nasty disease. It can cause sepsis and make people really unwell. So again, if you're offered it, then it's well worth having this, so you're ready for the winter. Next slide, thanks. Lots of vaccines. So the next one is shingles, which it's a painful disease. It's not very nice. I've seen mainly actually older residents with shingles infection, and it's basically caused by the chickenpox virus that no one actually ever really clears. It lives in the nerve root and remains there for life. And if your immunity is low, it can reactivate, and that's when it's called shingles. And it can be a really painful rash. It spreads through the nerve, so it can give you a specific type of pain called neuropathic pain, which people describe as an electric shock type pain. And actually, even once the shingles rash has cleared, it can cause a lot of pain. If it affects the optic nerve, so the one that supplies your eyes, it can cause blindness. So it's not a trivial illness, it's potentially very serious. And again, if you're older, if you've got a weakened immune system, then you're particularly at risk of serious shingles if it reactivates. So again, something that's very easy to protect yourself against by having that shingles vaccines, and the eligibility is there. It's a slightly complicated cohort because it's a relatively new vaccine, but it depends on your age, and it's generally between sort of the ages of 70 and 79, but they have lowered the threshold now. So there are some cohorts where if you've got a weakened immune system and you're aged over 18, you will have been invited for a shingles vaccine. Thanks, next slide. Perfect. I think this is the last one of the winter vaccines, which I'm sure you'll be pleased to know, because I appreciate there's a lot of information around vaccines. So this is the newest vaccination that was started last year, and it's called the RSV vaccination. So it stands for the respiratory syncytial virus, and this is a common cause for coughs and colds in people, but again, at the extremes of life, it can cause serious infection. So in babies, RSV causes bronchiolitis, which is, again, a serious illness where babies have respiratory distress, they can't feed, they often need hospital admission and oxygen therapy. And in older residents, it can cause pneumonia, again, which can lead to sepsis and can lead to people ending up on intensive care or worse. So that's why they launched this vaccination, to help protect residents against the RSV, and it is very effective. If you have the vaccine, it protects you against that very serious illness. And so, yeah, the chief kind of cohort, or those aged 75 to 79, or if you're aged over 80, because you might have missed the cohort before it was started. And now pregnant women is the other key demographic that we like to protect, because they will then pass on immunity to their baby, so that then they can be protected as well. So that's RSV vaccination. And then just, I thought I'd go through some myths that I come across quite regularly. And I think a lot of this came up particularly around COVID vaccine development, because it was developed so quickly, so people weren't as confident in it. But I've been trying to reassure residents that actually the reason why it came about so quickly was because COVID was just so devastating across the world. So whereas normally you can't recruit people to go into trials to test vaccines, in COVID it was very, very easy to, because everyone wanted to tackle it. I was a research volunteer, and I got the Oxford vaccine early on, sort of back in the May of after the first lockdown. I didn't know that I'd had it because they randomize you, but actually it turned out I did have the COVID vaccine, and that luckily protected me. And I didn't actually get COVID until 2 or 3 years into the outbreak. So because of that quick development, there was some kind of myths that that were surrounding that and other viruses, other vaccines, like it can cause infertility. And there's just no evidence for this at all. There's been many studies, both in terms of research before the vaccine was rolled out, and then also during the vaccines being actually administered to people. There's always a safety mechanism that we can feed back around any issues, and there's just been no link between infertility and vaccines. Some people often say that, well, you know, isn't it better that I get the disease and have my own natural immunity? And I often hear this with childhood vaccines and things like measles, but you know, measles can be a really serious illness. It can lead to disability, it can lead to deafness, it can lead to meningitis. So if there's a way of preventing it, why put yourself through the misery of having the disease and also the potential complications? So having vaccines is a very safe way to gain immunity without any of the bad effects of the actual disease, and it's much in the risk-benefit ratio, it's much safer to have the vaccine than not. And the other one that I hear is that about the long-term side effects, and you know, to reassure you, it is mainly the short-term inconvenient side effects, so feeling a bit under the weather for a day. And vaccines have been, you know, as I said, tested categorically. Yes, there can be side effects, but they are short-term, and if they weren't safe, we wouldn't be vaccinating people. You know, it's often said that vaccinations is the second most effective public health intervention in all of humanity, the first one being clean water and sanitation. It's, you know, it's a really important way to keep our communities healthy. Thanks. So yeah, so I think these are all the reasons to get vaccinated, especially, you know, coming up to the winter. We'll get into, you know, Christmas, and I remember actually the first time I got COVID was during the Christmas break, and you know, having the vaccines can avoid you having to, you know, rearrange plans, and you can just get on with life. It also, from a employee perspective, it means that you don't have to take sick leave as much, and also you are contributing to community immunity. You are protecting others by keeping viruses at bay. We've got a measles outbreak at the moment in North Hackney, and that's because our level of measles, mumps and rubella vaccine isn't high enough to protect the community. We've done a lot with our diverse communities to increase that, and there's a lot of positive work going on, but actually that's where we want to get to, is what we call herd immunity, where we have such coverage of vaccinations that actually it makes it very difficult for diseases to have outbreaks in the community. So that's a really important aim. And then the next slide is just some general advice about how to keep healthy. Going back to kind of the advice we had in COVID, so hands, face, space, you know, things like that do matter actually. So if you are indoors, opening a window, or, you know, having good hand hygiene, wearing masks if you've got a cough, these are all things to practice, and they can help avoid others getting unwell as well as yourself. There's also general things about eating well, making sure that you have plenty of fruit and vegetables, and actually topping up vitamin D is not a bad idea, but particularly over the winter, because we need sunlight to make vitamin D, and there isn't much sunlight obviously over the winter. So having an over-the-counter supplement of vitamin D can be helpful. Staying connected with people, making sure that you look out for vulnerable residents that might be around you is an important consideration. Being prepared if you've got long-term conditions, so making sure you've got enough medication, particularly over the Christmas break, so that you're not caught out. Staying active is important. It's harder in the winter, because obviously the nights are longer, but trying to do something, even if it's indoor exercise and using, you know, a YouTube video, that's better than, you know, not. And then looking after your mental health, keeping warm, and of course getting protected by having your vaccinations. Thanks. The next one is about, so if you've got long-term conditions, then making sure that you come for your checkups and your medication review before the winter starts, using 111 for advice, or GP, a GP consultation if you need that, and then staying informed, so making sure that you look at the letters that come from the NHS inviting you for vaccinations. So last slide before we finish is just some take-home points. So staying informed, being prepared, the importance of vaccinations, and then a wider lifestyle changes such as eating healthily, as I said, vitamin D, making sure that you exercise, keeping connected with people, especially in the winter, is important. So that's the end of the presentation, and hopefully there's a bit of time for questions if anyone has any, but I hope that's helped in terms of how to be winter ready from a health perspective.
Thank you for that presentation. I'll stop sharing just so we can see each other's faces a bit bigger. And then please come in, Rajita.
Thank you. Hi, Tassim. Thank you for a really informative presentation. I was just wondering on the shingles, what's the difference between the pathogen that causes shingles and compared to chickenpox?
So it's exactly the same. So it's the same virus that causes both. So actually, when you get chickenpox, your body never really fully clears it. So there's always like a dormant bit of the virus that lives in the spine cells in the back. And if your immunity is low, so people often get shingles when they are run down or stressed. And basically that is so that virus then comes out of the nerve cell in the back to the skin all the way, like it travels there and gives you the rash. So it's basically a reactivation of the same chickenpox virus. And what the shingles vaccination does is it primes your immune system so that actually if it does reactivate, it clears it very quickly because you've produced antibodies which neutralize that virus very quickly. If you didn't have that vaccine, then you'd have the full kind of, people often get this pain before the rash, and then they get the rash, and then they get pain after the rash. It's very much a relative of the herpes virus that also causes, for example, the cold sores on your lip. So that reactivates. People often find that when they run down, they get a reactivation of the virus because it still lives on the skin, but then your immunity is low. It's a similar sort of family. That's also actually the chickenpox virus is also the herpes part of that group. So yeah, it's very effective at preventing shingles outbreaks, having the vaccination.
I have a question. Could you just recap exactly where people can get vaccinated if they wanted to? We've got quite a diverse kind of core of professionals on the line, and I know that lots of them will be supporting residents in different ways. Was it mainly Richmond Road and yourselves that people can go to physically, or is it any of the GP practice where they can get vaccinated if they wanted to?
Yeah, so I think if you live in, so our service in the north covers, because it's the first time we've done COVID for a network of practices. So at Cranage Road, if you're registered at Cranage Road, Stamford Hill or Spring Hill, then we're doing lots of clinic, mainly based at Spring Hill practice, but we will be doing some pop-ups in the other two practices in the north as well. So you should have been contacted. So someone would have called you, or you should have had a text message asking you to book in for those. Similarly, Richmond Road is doing an offer for the rest of Hackney. So they're doing a housebound offer for those people that can't get to a site. We're also doing a housebound, but again, just in the north. And then if you're eligible, then they will have sent you a text message inviting you to the Richmond Road surgery to get vaccinated. And then the third way is by going on to, if you just type in NHS COVID vaccine, it'll show up where the walk-in sites are. And there is also a number that you can call for the NHS. It's 119, and that will tell you where your nearest COVID vaccine centre is. For all of the other vaccines, then it's usually via your GP surgery that you get that. So if you haven't been invited and you think that you're eligible, then contact your GP surgery and they'll be able to arrange the other, so the pneumococcal, the shingles, and flu vaccines.
That's really helpful, thank you. And before you come in, I just wanted to let organisations know, as part of Richmond Road, as part of their offer, are also exploring outreach to community events. So if you're putting on an event that you would like someone to come and have the option for members of the public to be vaccinated, provided they meet that kind of over 75 threshold. You can get in contact with Richmond Road. I'm going to pop the person running that program's email in the chat, and they can have an exploration about whether that's appropriate for them to come and do vaccination at your event. Abby, do you want to come in?
Yeah, thanks, Justine. I'm interested in the eligibility criteria and whether we anticipate that will expand over time. It seems quite limited right now, especially for instance, for like a flu jab. Do we anticipate those will expand?
Yeah, I mean, I think it depends on what the epidemiological studies say around the circulation of viruses and who might be particularly vulnerable. So, particularly the COVID vaccine eligibility, that's contracted every season. So now we've got quite a stringent criteria, and there were some news stories about some very angry residents that were being turned away from vaccination sites because they didn't fulfill the criteria and they wanted the vaccine. But that's based on kind of the circulating viruses and who they think is particularly vulnerable, and at a population level, who might be most beneficial to vaccinate. So, for example, with flu, it's interesting that although I mentioned for actually most children, flu is usually kind of relatively mild, apart from babies where it can be very serious. Children, school-age children, are the reservoirs of flu virus, and so actually vaccinating them means you're protecting the rest of the community. And actually, there is a caveat there. Flu can be serious for children as well, so there is an incentive there. So the eligibility flexes according to what the UK Health Security Agency feels, or the JCVI, the Joint Committee on Vaccinations and Immunisations, feel that the most risk is. So it will fluctuate a bit depending on that risk. And so, for example, this happened during the early phase of the COVID campaign, where actually it was quite a stringent criteria, and then COVID started spreading, and they expanded the cohorts massively because they wanted to protect as many people as possible. That situation could arise in the future, whether it's flu or COVID or any of the other vaccines as well.
Thank you. Jahada?
Hi, Charles. Dr. Tahsin, I have a question. So I'm a social prescriber and I am based at some of the community centres. I was just wondering how we can link in. I know Charles mentioned about outreach. So I was wondering, when I do my social prescribing drop-ins, maybe we can link in and get residents to come into those community centres and have their vaccines.
Yeah, I mean, I think that, social prescribers are such a good link to our residents, and particularly some people that might not want to access traditional, a GP appointment. See you. I think that's a really good idea. So what I'll also do is I'll pop. There's Mahmouda's email in the chat, but I can also pop my email in. And yeah, if there's specific needs, particularly in the north of the borough, we can.
Sure. Okay.
I'll connect you all up, Jahada, so we can have that conversation about what's the best way to do that with Family Action and the different practices across the PCNs in the borough. Do we have any other questions? Do we have any other questions for this presentation before we move on to our next one? Abby's coming in.
If someone else has a question, I can wait. But I'm just curious to learn more. You had said that you've been working with diverse communities to expand the access to vaccines. And I was just wondering what that's been looking like, how you've been approaching that, what you're learning.
Yeah, I mean, so I started initially, so as you know, there's a particular challenge of childhood vaccines in North Hackney. So we've got one of the lowest uptake areas in the north, in the entire country, and in fact, in Western Europe, I think. And predominantly that's within the Heredia Orthodox Jewish community. So there's been a lot of community engagement, particularly since the measles outbreak in May. And so we've co-produced the way that we run vaccine clinics. So when the outbreak first started, we've set up daily additional clinics. We have Sunday clinics as a routine service. We do community clinics at the Lubavitch Centre. And it's led to, and we also do specific comms for that community. in their channels because they don't have access to mainstream media. So it's led to around, I think, 2,600 vaccines being given since May. And I think as a result, we've been able to blunt some of that curve in terms of the outbreak of measles. So, and it was a very joint, so Raz is on the call, Raz was part of that team. So was Carolyn, the public health consultant, and our primary care network staff and our practices really helped to deliver that. So it's about looking at communities and working out. The other learning from COVID has been people aren't necessarily interested in vaccines, and that's for various reasons. And it might be because of trust issues, it might be confidence, but what we've tried to ask is what matters to people and what are they interested when it comes to health issues. So it might be access to mental health services, or, you know, access to gyms, for example. So if you start off with the, you know, question of what matters to people and what matters to communities, and build health literacy around vaccinations into that message, then we have we're more effective, and we're able to reach more residents than if we just go in saying, come in for your vaccines, it's the best thing ever, and don't give a fully balanced view. Because, you know, my aim isn't to, you know, vaccinate everyone in Hackney. It's to be able to provide a balanced view about vaccinations. I think they're great, but also I want to hear what's important to residents, so that they're able to feel empowered to make that decision for them and their family.
And just on that, I think it sounds obvious in the way that you've answered that question, but if there are other communities or other organizations working with communities who are interested in exploring that kind of more balanced approach and kind of exploring that with the people they work with, could they approach yourself and have a conversation about what that might look like for them and their organization? Absolutely,
yeah. I'd welcome that kind of engagement.
Okay, that's really helpful to know. Thank you very much for that presentation. Do we have any more questions for Dr. Tahseen about everything spoken about today? We do. There we go. It's always worth pausing. Jocelyn, do you want to come in?
Yes, please. Thank you for your presentation, Dr. Khan. I just wanted to ask that Hackney is a very multicultural borough, and as you appreciate, there are certain parts of the demographic that are more immune to severe health conditions like sickle cells, thalassemia, and so forth. With vaccinations, a lot of groups are very reluctant to accept COVID vaccination flu jabs. And I know throughout the COVID period, there has been a lot of work put in to support communities to engage and to make them aware of the positive side of vaccinations and so forth. And I think that with public health, that has been a joint project continuously to support those particular community groups to take up vaccinations. Is this still an issue at the moment, or is it? And as a council employee, what can we do in order to support these vulnerable individuals? Because when we go out to see people at their home, social workers or reviewing officers or access officers, it's very difficult because we're not clinicians. But at the same time, we can see they're struggling, they're not accepting clinical support as such. And I'm not sure how we can mitigate that situation.
Yeah, I think that's a really good question. And I think, you know, in answer to your question, yes, it is still definitely an issue. If anything, I think now more than, I think there was a lot more resource to be able to tackle some of the inequalities early on in the vaccination campaign. If you looked at the data of who was accepting the vaccine, it was predominantly in all boroughs, the white British population. I think it was only Brent where the Indian population actually had a higher vaccination uptake than the white British. And that is a challenge. And actually, if you look at the other thing is the deprivation index. So the more deprived you are, the less likely you are to get vaccinated. And that's across the board for most vaccines. So it is about having that conversation, and it is the offer of a conversation more than, you know, pushing vaccinations. And that's what I'd really like to stress is that, you know, people can talk to their GPs, their nurses, their pharmacists. And I think going back to your question about as council employees, I think using that, making every contact count, a simple intervention saying, actually, vaccines protect against serious illnesses and protect against complications from serious illnesses. And that, sometimes it's one of those things with vaccinations. There's often no one thing that leads someone to be vaccinated, but you might see an advert on the back of a bus. You might have a chat with a resident. They might go and talk to a neighbour. They might then talk to a GP, and that might then convert them into having vaccination. So every little helps in terms of any positive case you can present around vaccinations can help influence people. And ultimately, if they have clinical concerns, actually referring them to their practice for those conversations, rather than the pressure to be vaccinated, I think is really important as well.
Thank you.
No worries. Thanks.
Thank you. We've got obviously a very interesting topic here, lots of questions. Ali, do you want to come in?
Yeah, thank you. I agree that we can have conversations with health practitioners, including doctors, nurses, etc. But some of my experiences and the people that I work with, I'll take me personally, I'll speak for myself. If I've been contacted and said, no, I'm not interested in a vaccine, then I'm getting phone calls. Why don't you want the vaccine? I just don't want it. And I don't want to have a conversation about it. And I don't want to get numerous texts on a daily basis about it. So how do we, if somebody says, I'm not interested, is that on our record to say that, please stop contacting a person? Because I'd love to be able to go and speak to somebody around maybe other conditions, but not with the maybe follow-up conversation. Oh, have you thought about a vaccine? I'm not coming to speak about that. I'll be talking about something else. So I suppose my question is, how do you opt out fully from being contacted around having certain vaccines? Thank you.
Thanks. So we do code, like on a practice level, where people have told us explicitly that they do not want contacting, then we can code that. The problem is sometimes people do change their minds. And, in the first wave, for example, of COVID vaccines, there were people that didn't want it. And then in the second and third wave, they changed their minds. So there's that balance of how do you make sure you don't exclude anyone that might have changed their mind. When it comes to a national offer, so often the national team gets in there before we do as GPs, and you might get a letter or a text message. We have not that much control over who gets invited there, because they just then see the risk cohorts and that someone's eligible for a vaccine and might just send out an email or a letter. But where we hear from people that they don't want, and that's a completely, I think, again, the point is that what really, I think our aim is to have that opportunity to talk about the vaccine. If that is that I don't want to, consider it and that's not for me, so be it, because that is an informed decision. I think the challenge is in the midst of a lot of misinformation that people don't get a balanced view. And it's always that opportunity to be able to talk to people. So yeah, going back to your question, where we have an explicit request not to contact people, we do code that in our systems.
Thank you. I think that's helpful to know, because not everyone will want to have that conversation. And Ali, thank you for raising that from your point of view. I want to pause again, just in case we have any more, but then we've also we've got Raz's presentation to come as well. We've got a theme today about winter wellness, so we do have a little bit more to come. I think are we done for questions for this presentation? I'm getting a sense we are. So thank you very much for that. Justina, I really appreciate it. You'll feel welcome to stay on the call and listen to Raz's presentation as well, but if you do need to drop off, that's fine. And I'll pass over to Raz.
Thank you so much. Apologies, just a change. It's not really to talk about winter wellness, but it's to promote a winter wellness session that we will be holding together with the Population Health Hub on the 19th of November at 12 o'clock. So it will touch on similar aspects that Dr. Tassin mentioned around winter vaccines, for example, and non-seasonal vaccines, but we will touch more broadly about winter and the weather forecast, how winter broadly impacts on health of the general population, who is most at risk of severe harms, including settings. Then we'll touch into advice for planning ahead of adverse weather. So for example, snow, extreme cold when you can't leave the house, or perhaps advice to your children when attending school. We will have some information around keeping yourself warm and some of the things or grants or channels of advice and support that you can take to maximize your winter warmth. Then we'll speak about the common winter bugs, so looking at flu, RSV, COVID-19, pertussis, some of these common winter bugs and norovirus as such that are more prevalent during winter. And then finally touch on some of the winter vaccines that Dr. Tahseen Khan mentioned today. The final thing is just about promoting where to get the right care at the right time so that we can make sure that we're not burdening the health and care system and misusing it as not to be intended. So I will put the Eventbrite link in the chat, and I hope to see you all there.
Thank you. It sounds like an interesting session. We know lots of planning for winter. I mean, it comes around again and again, so it's good to be prepared for it each year and think about what we can do as professionals. Does anyone have any questions for Raz about that event or anything further? I'm sure there'll be details in the Eventbrite as well.
Thank you. Sorry, apologies. Yes, I will put it in the Eventbrite there. And it was just another point that we've also developed guidance and action cards for cold weather. So if you are in a frontline facing role, for example, and you're supporting residents who may be at risk of cold weather, so like older people, young children, people with underlying health issues, then I'm quite happy to circulate that guidance and advice in advance of this webinar, or just separately to it, just so you have this resource to hand and you don't need to wait to get further information until then.
Thank you very much. Does anyone have any additional questions for us about that event? Great. So if you're really interested in this area, please do sign up for that. That's a great opportunity to learn more and recap some of what we've done today. But it sounds like there's a lot more detail about other aspects of preparing for winter as well. So that's the end of our presentations for today and what we're going to speak about. I'm going to turn the recording off in a sec so we can leave it open to that more broad conversation in this meeting. But just before I do that, does anyone have anything that they want to promote or kind of make people aware of that's happening in the borough in the next 2 weeks or so? Molly, do you want to come in?
It's not something that's happening in the borough in the next 2 weeks. Sorry, I put my hand up before you said that.
You can promote. That's fine.
Thank you. So I spoke about this last time I came, but just put in the chat as well about the London Resilient Communities Programme. So that's for all sorts of different community organisations and faith organisations to support you to create community emergency plans. And if you are a space, a venue, to look at becoming a community resilience hub, there's more information on the website. So I think one way of thinking about the programme is, if people in your community turn to you in times of challenge, like around challenges overseas, flooding, other emergencies in the local area, then this will help you kind of be prepared for those, and that will be through training and resources, and also through a small grant programme. So yeah, that's just the London Resilient Communities Programme. But yeah, thank you.
Thank you, Molly. Sorry, my laptop's just running out of battery, so I have to run to a different place to plug it in again. There we go. Does anyone else have anything else they want to promote before I kind of put an end to this part of the session and we can have an open conversation without the recording? No, my final plug is I talk often about Crew Energy. They'll be here next week to speak about how to save money on your bills during this period. We know that energy prices are going up and it impacts people's ability to balance that complex kind of balance of food, fuel, and all the other bills coming in and out of people's houses. You can reduce your energy consumption in a way that doesn't impact your life. That can save you a lot of money. Crew are going to talk about that, but we're also across multiple libraries in the borough once a month. If you we aren't able to come and attend your session for whatever reason, and you have a resident who's really struggling with their energy and want to have a conversation with an expert, please let them know that we'll be in the libraries and signpost them to that sessions there. And if that's everything, I'm just going to end the recording there and we'll have a more general chat. Thank you.